Before we begin, we want to acknowledge that some stories and discussions in this episode of Radiant Resilience may touch on sensitive and potentially triggering topics. These may include themes of medical procedures, including detailed descriptions of lumbar puncture and eye injections, discussion of potential blindness and health anxieties, mention of serious medical conditions. Our goal is to share real life experiences in a respectful and empathetic manner, offering insights into the complexities of the human spirit and the journey towards resilience. However, we understand that some content might be difficult for listeners. We encourage you to prioritize your well being and discretion when deciding to listen. Please remember this podcast is not a substitute for professional advice or support. If you find yourself needing assistance, we urge you to seek help from qualified professionals or trusted support systems. Your mental and emotional health is important to us. Thank you for your courage and for joining us in a space of understanding and compassion. Welcome back, everyone, to Radiant Resilience. I'm here today with my youngest cousin, which is really funny because I'm the oldest of the cousins. So there are many of us in between. Her name is Rebecca Horton, and she lives in Thornton, Colorado. She is, and I'm going to try not to butcher this name. I just asked her before we started recording how to say it, ophthalmic technician, which we'll get into, I think, here in a bit more deeper. She's 21, loves art, hockey, and car racing. And our topic today that we're going to talk about is back in December 2023, she got diagnosed with a rare eye condition. And if she didn't speak up and advocate for herself, she probably would be blind right now. So this is super interesting because I actually don't know very much of this story. So I'm going to learn right along with everybody listening. So Becca, where do you want to start?
I guess I'll just start with what I first noticed.
Yeah,
So,
absolutely.
yeah, I had woken up on a Saturday and I was getting ready to do something with my day, and I noticed some static in the lower part of my vision. And I was
And
like,
what do you mean by
okay, that's
static
weird.
for those who
You
don't know
know,
what you're talking about?
yeah, like on an older TV, if the antennas aren't right, it had that static over the TV screen.
Yeah.
That's what I was seeing.
Oh, okay. That's crazy. And you'd never seen that before?
Never in my life.
Okay.
So I thought maybe I'm just over wearing my contacts. Maybe I rubbed my eyes a little too hard because sometimes you can get that from rubbing your eyes. And I'm like, okay, weird. It lasted about 10 minutes, went about my day. Next morning, I wake up, same thing.
Hmm.
Like, okay, this is getting weird.
Okay. How long did it last that time?
Another 10, 15 minutes ish.
Okay.
That Monday, I'm like, okay, I'm just gonna be wearing glasses for a few days. Maybe that'll make it go away.
Sure.
And then about a Thursday, like a weekend, I'm like, okay, I'm tired of this. I'm gonna go ask one of my bosses who's a uveitis specialist, which is something important later. I'll get more into that in a
Mm-hmm.
moment. I'm like, hey, take a look. Here's my symptoms. Here's what I'm noticing. Can you take a look? And it's funny because the doctor that had taken a look is one of those very blunt. He doesn't really show a lot of emotions. He's very straight cut, straight to the point. And all I hear is, oh, that's not normal.
Oh.
Greatest
That's
thing
not
you
what you want
ever
to
want
hear
to
from a
hear.
doctor. Yeah.
Yeah. So I'm like, okay, what do I do? And he listed off all these symptoms, and most of what I've learned has been on the job. So I'm like, I don't know what that means. So he
Yeah.
was giving me all these things. He's, oh yeah, your optic nerve is at a 4+, and you have tortuous vessels. I'm like, I don't know what that means.
Mm-hmm.
But he said, don't worry about it. I'll continue to monitor it. I'll check it tomorrow. So the following day was a Friday. And I had worked that morning shift with that same doctor who had taken a look. And he pulls me aside and he said, hey, I don't mean to freak you out, but after your shift, don't meet me at the next location because we travel between locations for him.
Okay.
He said, go to the ER right now.
Oh no.
I'm like, oh, okay. So I go home, get a couple things, tell my mom, she goes with me. And we head to the hospital, checked in at 1:30, and I stroll up to them and I'm like, okay, because I'd done my little bit of Googling the night before. I'm like, what could this be?
Which
Hi
never
guys.
leads down a good path.
Yeah, never does. So, of course, Dr. Google says papilledema, which is swelling of the optic nerve.
Okay.
So I go up to him, I'm like, hi, I think I have papilledema. Not, I think, what the nurses were expecting to hear at
Sure.
all, but what I went up and said.
Yeah, sure.
And by the time they had gotten me back, they started doing my initial blood work. It was like 3 o'clock. Finally got back to hanging out with my mom in the hospital room. And they're like, hey, so based off of your symptoms, we're going to do a few different tests. So they had me do a lot of reflex tests. I had to do a lot of like connecting my fingers to like the neurologist's finger, a lot of just basic tests to see if I had any mental paralysis or anything. And I didn't have any issues. And I had about, this sounds dramatic, but I don't think it is, about 7 or 8 doctors who came in and were like, oh, we want to take a look at the medical mysteries.
Oh no, you don't want to be that person.
Never do.
Oh no.
But they had their ophthalmologist finally come in and say, okay, here's what I see on the dilated exam. Based on that, we're going to get MRI, CT scan, and a lumbar puncture pending the results of the MRI and CAT scan. So I'm
Okay.
like, I hope they can just figure this out with an MRI or a CAT scan because I really don't want a lumbar puncture.
I don't even know what that is.
It's where they take a bit of your spinal fluid and then test it.
Oh, yeah, that sounds unpleasant.
Yeah. I've watched enough House MD to know what I was getting myself into.
Okay.
We're like, okay, we'll just wait for the MRI machine and CAT scan to be open. And I'm pretty sure they skipped over us like 3 or 4 times.
The ER is such a frustrating place to be. Nothing happens fast and nothing happens
No,
efficiently. It's amazing to me.
it is insane. What should have been like a 5 or 6 hour visit was like 24 hours in total
Ugh.
after everything was all said and done here.
Oh man.
Oh my gosh. So I finally had my CAT scan at like almost 2 o'clock in the morning and MRI at 4 in the morning. And I was like, okay, we'll just wait for the results. Both came back clean,
Okay.
totally fine. So they're like, all right, lumbar puncture it is.
Oh no.
And this was the worst part of the whole thing.
Ugh.
Absolute worst. So what they have you do is they have you crawl into this fetal position and they put some betadine on the back to clean it off. They inject some lidocaine so you don't feel it. And I'm like, okay, that's terrifying. I know what I'm getting into. Can you hook me up with some fun stuff at least so I'm not like aware of all of this?
Yeah.
Because they can't knock you out for it.
Oh,
You have to
really?
be awake for it.
Why do you have to be awake for it?
So they can gauge where it is and if they need you to be repositioned, you can move at
Oh,
that time.
wow. Okay.
So they gave me like 2 rounds of Toradol and they did the lidocaine, felt every bit of it. I'm
Oh,
like, okay, let's do this. Let's just get it over with, call it a day. So I
yeah.
can get out of here. Because at this point, I was there for 20 hours. I'm like, I want to leave. Let's
Oh
just get it
my
done.
gosh.
So, long story short, I found out the hard way numbing doesn't work on me.
So is that the first
So,
time you'd ever had anything numbed?
I'd like dental stuff I've had numb and that works fine on me, but for some reason when they numbed my spine, it didn't do anything.
Oh my gosh. That sounds awful.
So for about like 30 minutes, I felt every jab of that needle going through my spine.
Oh,
Oh my God.
did you tell them or were you just trying to
Yeah,
bear
I
through
told
it?
them a little bit of both.
Yeah.
It's silly because at one point I'd calmed down with my breathing enough, and the guy was like, "Oh, good job." And I'm like, "We're done, right?" And he said, "No, you calmed down your breathing."
Oh, shoot.
But I remember very distinctly telling my mom, like, why can't this be something like uveitis? Something simple. I know how to fix that.
Yeah.
But at that time, they were just like, yep, okay, we're gonna keep going with the LP attempt. And my mom finally jumped in. She's like, okay, you're done. You're done. Because for 30 minutes, they were going around my spine with the 26 gauge needle.
Oh my gosh.
Nasty, disgusting, terrible. Wouldn't recommend it.
So did they get answers from that test though?
They never actually got it.
Oh, they never got the fluid.
They never got it. They couldn't get to it.
Oh no.
We're like, okay, just stop. We can't do this.
Yeah. Yeah.
It was, oh, it was so bad between the IV in my arm, them literally stabbing around in my back. I couldn't walk around for the life of me
Mm,
because it was like the junction between your hips and your spine.
okay.
So walking around, I like needed assistance.
Oh man.
So I called my managers at work. I'm like, hey, I'm not going to be at work for 2 to 3 days
Oh,
because I can't walk.
yeah, for sure.
And like with what I do at work, I'm not the tech that does like eye prescriptions, doing like the 1 or 2 tests. I do retina stuff, which is all back of the eye. And for that, we're doing medication injections, and I have to be running around working up patients, getting them their medication. And it's a lot of space to run around. I can't just sit down and do it.
Yeah.
That Monday that I had called out, it was my first day calling out. I had received a call from their ophthalmology department from the ER. And they're like, hey, we have a uveitis specialist who wants to take a look at your case. Okay, the doctor I had look at me already said he was a uveitis specialist, and he is. So, okay, I don't really think they're going to find anything different. But
Yeah.
I was like, what do I have to lose?
Yeah. Sure.
On that Tuesday, the day after, they dilated my eyes, and he's okay. Based off of your symptoms and what I'm seeing in the back of the eye, there's a couple things it could be: multiple sclerosis,
Oh,
leukemia, syphilis, or what he called papillophlebitis.
okay. That's a lot of different crazy things.
A lot of fancy words.
Yeah.
So to figure out what it was of those two, he had me do some more blood work, and he also had me do 3 tests where they took pictures of my eyes.
So at this point, were you still waking up with the
Yeah, I was
vision thing
still,
every morning?
yeah.
Okay.
Mhm.
Shoot.
That's a good question. Yeah. I feel like that's very important. So I
Yeah.
was still, yeah, symptomatic at this point. I'm like, okay, cool. Those are some possible answers.
Yeah.
And from there, there's a couple different testing between the blood work and the scans of the eyes. So they can do like a 3D scan of the middle part of the eye, which is where all of our center vision comes from. And they also scan my optic nerve. And the third test was a dye test. So they get pictures of the whole back of the eye, but then they inject some yellow based dye into the eye, flows through the bloodstream, and lights up the vessels in the eye.
Oh, wow.
So I actually got the picture ready to go because I feel it it's important. So this is the left eye. It's
Oh,
completely
wow.
normal,
Okay. That's a normal scan. Okay.
normal, happy scan. And my right eye kind of looks like a lightning storm here.
Oh my gosh. That's actually a really sweet photo. But yeah, so if you're not watching the video of this, literally looks like
Mhm.
a normal lightning storm, I feel like, on the left eye.
Yeah.
Nothing really crazy. And then her right eye has like a big, bright ball of like lightning in one spot and then way more lightnings around it. So, obviously not the same in both.
Not good.
Yeah. Okay. So what did they
And
say when they did that?
they're like, based off of your blood work and the dye test here, papillophlebitis.
Which is what, is that the same thing you said when you went into the ER that you had?
Similar. So I said
Okay.
papilledema, which
Okay.
is it's a lot in a lot of medical mumbo jumbo. So
So
the
what,
papillo,
yeah, tell me what the
sorry.
difference is between those two.
So papilledema is just swelling of the optic nerve, and it's typically a sign of a brain bleed or a brain tumor,
Oh, so
which,
that's good that we didn't have that.
yeah,
Yeah.
luckily CAT scan and MRI ruled that out.
Okay.
So the papillophlebitis is the optic nerve being swollen along with the vessels of the eye being swollen. So
Okay.
that lightning storm showing off those really thick vessels showed the phlebitis, which is phleb for like vessel, and
Hmm.
itis for swelling.
Okay. Okay.
Yeah. So I'm
All
like,
right. So
okay,
you finally get this diagnosis. Then what?
there's a couple ways of treating it.
Okay.
There is going on to steroids like prednisone,
Mm, I know all about that.
and
Not very fun. How long would they put you on that for?
I was on it a total of 2 months.
Oh, yep, that's a long time. I can
Mhm.
commiserate with that. And then did they have you like wean off of it too?
Yeah.
Yeah, which I don't know about your weaning off, but my weaning off was like, okay, take half a pill for 2 days and stop. And then, yeah, that was literally what they had me. That's how they had me wean off of it. And then my whole body, each time I had to do it, ached. Like all my muscles, it was like achy, almost like flu achy. And then I
Yeah.
was itchy afterwards. And then all
Yes.
of that finally went away. And then I would start it back up again.
Yeah, they had me start at 60 milligrams and they're like, okay, after a week, drop it down to 50, and then so on and so forth.
Yeah, they did not have
So,
me do it that much. I don't remember the dose I was on specifically. I have it
yeah.
written down somewhere, but I remember
Mhm.
thinking when they told me to wean off of it like that, I was like, what? That's all?
Yeah,
Okay.
that's a lot for prednisone. Oh my God.
No. And I was on it for months too. So
Oh,
yeah. Yeah, I was pretty much on it from April or May of last year, basically until November, with a little bit of a break in between each one.
oh my God.
Yeah. Yeah.
Oof.
Yeah, it was fun. Anyways, continue. Sorry.
No, that is all good to know. A couple days after I started going down to the 50 milligrams, I noticed something very particular in my vision. And
Okay.
this couple of days after happened to be Christmas Eve.
Oh, okay.
So, with the normal side effects of prednisone, you have your brain fog, your irritability, all the fun. And all of a sudden, I have no center vision in my right eye.
Oh no.
Instead of being able to see what through your central vision, I just saw this big gray blob.
Oh no. So did you like wake up to that or it just happened
It
at
just
some
happened. I was
point?
drawing on my iPad, just hanging out before we went to visit my dad's side of the family, and I was like, oh, that's not good. So I
No.
covered both eyes, looked back and forth. I'm like, okay, don't like that.
So you said this was when you started weaning off the prednisone. So you'd already been on it
Yes,
for a couple months
about a
or how long
week.
at that point? A week at that
It
point.
was about a
Okay.
week, yeah.
Okay. So do you
And
feel like was it helping the previous issue
it
or not?
wasn't.
Oh, okay.
The kicker was that it wasn't helping.
Okay.
So the next day, or a couple days later, I had it again because it had resolved on Christmas. So I was like, okay, I'm fine. We're good, right? Maybe the prednisone caught that weird thing in time that I don't have it again.
Mhm.
I go to work that following day that it wasn't Christmas, and got straight to work right after I got out of my car. I'm like, I still don't have central vision. I should probably get that checked out.
Yeah.
I call up my mom, who calls the ophthalmology department because I was walking into work. I'm like, what am I gonna do? I have to work,
Yeah.
and they get me in, and I tell my boss at the time, I'm like, bye, gotta go. I don't have central vision.
Which, since you work at an eye doctor's office, maybe they're a little bit more empathetic to that.
They were like,
Oh,
no,
good.
get out of here. Get
Good.
out of here now.
Okay. All right. So then what?
So another couple scans, and later they're like, okay, yep, we're starting to see swelling in your macula. So the macula is where all of the central vision comes from.
Okay.
So that was starting to swell as well. And they also had seen some cysts in there.
Oh,
Yeah,
in your eye?
in the eye.
I did
In
not
like
know
the
you could get
the
cysts in your eye. Go ahead. Say what you're going to
yep. Yeah. So she sends me back to the doctor who had started me on everything. And he said, hey, I got one more doctor I want to get on this case. Do you mind if I bring him in? The joke is he's the oldest of the uveitis doctors. He's pretty much seen it all at this point. He's been doing this 40 plus years.
Yeah.
He looks over everything. I had to do a visual field test as well. So they patched up one eye, and I had to look at the orange dot in the center of this machine. And I had to click this little button whenever I saw anything flash. And as we thought, nothing in the center. So
Oh, wow.
they printed out the scan. I just had this big black blob in the center. So imagine like a little grid, big old blob in the middle of the grid.
Wow.
They're like, yep, sure enough, kiddo. So the other ways of treating what I had, there was two ways. There is regular eye injection, which is like just shot with just a little bit of fluid in a syringe into the eye, or
A
a
shot
steroid implant, a shot
into your eye?
into the eye,
Ah, okay. Or a steroid what?
implant also into the eye.
Implant, like it would stay there for forever?
It would dissolve, but yeah,
Okay. But how do they my eyes, I like don't even want to open my eyes right now. I'm like, oh no. Okay. So how do they do the steroid implant? They just shoot it in like with a
similar.
needle too?
Yep,
Oh. Okay. So
it's
which did you
terrible.
decide to
It's
do?
awful. Based on the fact that the prednisone didn't work and it actually made me worse, they said, okay, we're going to treat with Avastin, which is the medication name,
Okay.
which is not a steroid being chucked into my eye, which I was like, awesome. I love that.
Yeah,
I'll
that's a
take
much
it.
better choice.
I'll take it. It's the better of the two evils.
Yeah.
And I actually watch eye injections at my work all the time. So I knew what to
Probably made
expect.
it a little bit easier then because you like know. Do they numb your eye then when they do that with the drops
Yes.
first?
Hmm.
Okay, I just had LASIK done in January in Colombia. Yeah, it was pretty fantastic, by the way. Great decision to do. And I had a wonderful doctor, but the numbing eye drops are so weird. It's like
They're
such a
so
weird
weird.
feeling. So I'm assuming they numb you with the drops and then they poke you.
Yep.
Mm. Were you scared at all?
So definitely, yeah. There's always complications with every procedure. It's a needle in my eye,
Yeah, for sure. Okay,
but
so you did that. Did it work?
it worked beautifully
Yay!
because when I walked into my appointment that day, my vision had gotten so bad that it was 2500. The goal is 2020.
Yeah.
The bigger the number, the worse it is.
Oh, okay.
They were almost to the point where they would have to go up to me and be like, how many fingers do you see here?
And you're like, I don't see any.
I don't. I didn't.
Oh my gosh, that's so scary. So did the shot work like immediately or did it take some time?
It took about a day for me.
Okay. So you did the shot and
So,
then did you just go home and relax?
yep.
Okay.
The worst part about it is there is the occasional blood vessel break with these.
Okay.
So I had this big old red eye, like this entire half of my right eye was red for about a month.
Oh, wow.
And yeah, went about my day. I originally had made an appointment to go see that doctor I'd worked with just so I could have my stuff in the system if I ever needed anything.
Yeah,
So the
sure.
next day, I actually had that already scheduled.
Nice.
They were able to go in and check my vision, went from 2500 to 2025.
Okay.
which was insane because that gray spot in my vision went away.
Wow. So have you
So
had any
what
issues since?
I have not.
Okay. That's good. Is it something that can come back?
I can.
Okay. So you just watch it. Are you afraid it's going to come back? What's the likelihood of it coming back?
I don't know percentages and likelihood, but most of our patients who have the vein occlusion, which is what I had, often pretty much have to get it for the rest of their life. But they're assuming
Oh,
since I'm young, I'm healthy, I have no other previous medical issues. That's why I cleared up so well.
okay.
Mhm.
So if it comes back, you just do that shot again? Okay.
A couple weeks later, they actually did a second of the shot. So I've had two.
Just to be sure.
Yep.
Okay.
But that optic nerve swelling went down immensely. The vessels looked a lot less squiggly.
So did you have that dye test done again then?
Yes. Let
Okay.
me pull that.
Oh yeah, show me the fixed version.
Happy right eye.
Oh yeah. Looks a lot more normal, like the other left eye. So just normal
Yep.
lightning bolts, which is actually pretty sweet to look at. I've never seen anything like that before.
Yeah.
I've never had
And
very extensive eye problems before. I just couldn't see very well.
wouldn't recommend them.
Shoot, so how did you feel after going through all of that?
It was a lot to process because I was like, I'm 21. You go through your life in your early 20s, think nothing could be wrong with you,
Yeah, you're
but
definitely
it's little
feeling
things like
in
that.
you feel invincible for sure when you're in your
Yeah.
20s.
Mhm. But I'm
Yeah,
like, there was no reasoning behind what I had.
which is so infuriating, I think. I feel like I meet more people that don't they have issues and they go to the doctor and the doctor's I don't know, let's try this test, let's try that. And it's
Yep.
meanwhile you're dealing with this situation and all you want to do is fix it and they don't know what it is. And it's absolutely
Exactly.
infuriating. So I'm so sorry.
But I'm glad I'm not normally one to say, hey, I'm having an issue. But if I didn't ask that doctor originally to take a look at me, I would probably be blind right now.
That's crazy. So this is something that can cause complete loss of vision. Would it just be in that one eye or what could it have spread to the other eye?
It was just in the one.
Okay,
It's not very common that it would spread to the other, but it's not impossible, of course.
sure. Ugh.
A lot. Eye stuff is gross.
It's so interesting though that you work at an eye doctor and something like, could you have picked, is it something that's contagious? Is it something you could have picked up in
No,
the office?
no, not at all.
That's crazy.
Yeah, if it was the other options, it could have been autoimmune or it could have been like I joke, of course, we all joke at my job, all my coworkers and I, that it could have been syphilis, which we would have a lot of questions if that was the case.
That's funny that was an option. I don't know much about syphilis, but it's funny that was considered. Apparently that has
Definitely.
something to do with your vision being off.
Yeah, sometimes syphilis can make your optic nerve really big.
Really?
Yep,
So have you had people at your work that have experienced that like patients that have come in with that?
yep. We have patients with syphilis. Yeah.
Just don't ask more questions.
Yeah. Knowing what I know now, whenever we have patients who've never had an injection before, of course they're terrified. But
Yeah.
I, this 21-year-old kid can go up to him and be like, here's what to expect, here's what you'll see, here's what you might notice. And every single time they come back and they see me, they're like, that was exactly what you said.
Yeah. It's interesting how you can, when you've done it firsthand, you can relate to it a lot more and you can explain it a lot better.
Definitely. And we do a couple different types of numbing at my work. And for me, they only did the drops and then some antiseptic. And I feel like sometimes with our patients saying it hurts a lot more, I'm like, you had more numbing than I did, you silly. So I don't know why.
But the eye
I mean,
numbing worked for you then.
yeah, it worked super well. There was pressure because they were putting fluid into the eye. So my pressure in my eye went up a bit. But All I really felt was a headache after. I didn't actually feel the needle in my eye.
Yeah, that's good. I know. I found out after my LASIK surgery that they had shaved off my eye,
Mhm.
and I did not really know that was going to happen. Sorry for anyone's listening that maybe doesn't know that fact, but I was glad in the end that I didn't know that. And it felt like
Yeah,
the little machine that they put onto it. I don't know if you guys do LASIK at your office, but the little machine that they attach to it that does the shaving felt like the pressure, what you're talking about. It felt like a
yeah,
water jet is what I had in my brain while it was
yeah,
happening, going around my eye. And so then after the surgery, the next day when I came in for my follow up, I was like, what was the thing that felt like water pressure going around my eye? And he was like, oh, yeah, that's like the razor that we like cut your eye. And
Oh
I was like,
no.
oh, I don't know if I would have done this if I'd have known that was going to be the case. So obviously, I think he didn't tell me that part for a reason, but yeah, that's all it felt like. It felt like a water jet was just like cleaning my eye, is almost what it felt like.
Yeah. The most I noticed, because the actual injection's like 10 seconds,
Mhm.
was like when you're recording a video and you drop your phone, you go to recheck the footage and you just watch the world go down as your phone falls down.
Yes.
That's what it looked like. So the world dipped down for a second.
Okay.
So that was the only really weird thing for me.
So this
But
was
I'm,
from, oh, go ahead. I'll let you finish.
yeah, I go for it.
This started in December, you said.
Mhm.
And then when were you done with all of it after the shot, after healing and everything?
My second shot was the 31st of January,
Okay.
and I've been good since. So it's been like 18 weeks at the time of recording.
Okay.
No third injection. They've done a couple more dye tests on me. They did more scans of my eyes. They're looking a lot happier.
Awesome. And you've not seen anything weird in your vision since?
Not since.
No fun hallucinations or anything like that.
None of the good stuff, unfortunately.
Darn it. I'm so sorry that you had to go through all of that. That's a lot for somebody so young to experience. Like you said, you're so young and health issues just don't normally pop up in somebody your age like that are that
Mhm.
serious and that rare too.
Yeah. And the weird thing is uveitis, which is essentially what I had. It's like the broad umbrella term for what I had. Typically affects people who have autoimmune conditions or people with previous trauma to the body.
Hmm.
I didn't have any of that. I joke with my mom because she's the one with the autoimmune in the family. I'm like,
Yeah.
why wasn't it you, Goofy? She's like, what? We look at each other and we're like, why didn't you have it? But you did.
Autoimmune stuff is so interesting, I think. It's so unpredictable.
It is wild.
Yeah. And a lot of the times they can't test for some of that stuff. It's pretty crazy.
The kicker lies in the fact that for my mom's birthday, a couple of our uncles and aunts got together for my mom's birthday. And one of our uncles said, oh, yeah, I've had uveitis.
Who? Are you allowed to say
Our
on
Uncle
here?
Tim.
Uncle Tim? Really?
Yeah,
So can it be a genetic thing?
it can be.
Okay. Interesting.
But
So
what
did,
he
yeah.
had was more at the front of the eye that can be treated with drops. He
Oh.
had the easy route.
Wow. I didn't know that. How
Mhm.
old was he when he had that? Did he say?
Within the last few years.
Oh, really? Recently?
Mhm.
Is it more common in older people?
It's actually younger people it affects most.
Oh, interesting. Do you
Mhm.
have any food allergies or anything like that?
None.
None. Lucky duck. Yeah. So no autoimmune things whatsoever except for this. Because they usually say once you have an autoimmune something, you usually end up with multiple.
Yeah, exactly.
Who knows what's going to pop up for you in the next however many years?
Just keeping my life
Hope,
interesting.
hopefully nothing, but you never know. Were you pretty scared through all of this?
I was horrified because I'm like, I can't watch hockey, I can't draw, I can't go racing because I don't want to drive a car like this.
No, yeah, you definitely couldn't drive like that. So that probably impacted you quite a bit.
Yeah, I was horrified because here in a few weeks, my family and I were getting ready to do a race where we go from state to state and race at different tracks. I'm like, I I can't do that
Mm,
if I'm blind.
yeah.
I've got a car my brother, my dad, and I all chipped in on, and I'm like, if I can't race that, what am I gonna do?
Mm, yeah, that's tough. So you knew most of the time that was a possibility,
I did.
that being blind in that eye was a very big possibility.
Unfortunately, yeah.
Oh man. Well, that is scary. I'm glad it didn't go that way.
Me too.
Was it a relief when that shot worked? Were you just thank God?
Yes. Yeah, I texted a couple of my buddies in like the uveitis department at work, and I said, guys, I don't need a steroid being injected into my eye because
Yeah.
that was the best part.
Yeah, for sure.
Because
Ugh. So how did you feel
steroid,
about, talk to me about the relief you felt when it all, because you said you were talking about how you were feeling about the blindness being a possibility. So then when that
mhm,
was no longer going to be a factor, how did you feel?
just so much relief.
Yeah.
Just, I remember just crying every day just because I was so happy that I could do the things I love, and
Mm.
I could be able to help our patients as well, which makes me feel good because I love my job.
Did it bring on like a new appreciation for your job? Like
Oh my
having
God,
that
so
eye
much.
experience, like maybe you have a little bit more passion for that now because of that experience.
I do. They have started putting me mostly in the uveitis departments at work because I'm able to explain it better to our fellow younger patients.
Interesting.
Hmm.
That's really cool.
Yeah.
And it is true. Like when you experience something firsthand, you have a lot more empathy and stuff about it and knowledge and yeah. And I'm sure patients appreciate that too, because I will say at my fertility clinic,
Hmm.
the medical assistants, although I loved them, they were wonderful people, had no clue what the patients were going through.
Exactly. And it's so much harder being the patient, I feel.
Yeah. And if you don't feel like your medical team, not that I want everybody to have to experience those things and that you have to experience it in
Yeah.
order to treat people, but I think it's a different dynamic if you can do that.
Yeah. The team I had at the other doctor, so fantastic. Love
Oh,
all of them.
good. Good. Well,
Yeah.
oh, what a crazy story. And thank you for sharing that.
No worries.
Hopefully somebody listening maybe can relate and learn something, or I can put Becca's contact information and social media and stuff in the
Yeah.
show notes so you can reach out in case somebody's experiencing that. But I think it was really important for you to advocate
Yeah.
for yourself too. I'm really glad that you did that.
Truly. Because I don't know where I'd be right now if I didn't.
Yeah. Might be a very different outcome, right?
Hmm.
And I think it's true. I think in general, we need to advocate for ourselves, anything medical related. And it's not necessarily
Unfortunately.
to say that doctors or nurses are bad or anything like that. It's just, I think that
Hmm.
they're, a lot of them are overworked and have too much going on. And it's really hard to really focus on each individual case. So if you find something that you maybe want to try or something you maybe want to, that it might be or might not, I don't know.
Yeah.
Do this test, do that test, do this treatment, do that treatment. Like you really, it's so important in our medical world today to advocate for yourself 100%.
Definitely. And I understand like being on both sides now because patients are like, oh, what does this mean? What can I expect? I'm like, here's what you may expect, but I'm also A, not a doctor, and B, I'm not in your shoes this time.
Yeah. Yeah, that's tough. I have a friend who just went for an ultrasound because she had a lump in her neck and she wanted the ultrasound tech
Yeah.
to tell her what it was. And of course they won't. They have to send it to the doctor and the doctor
Yeah,
has
we
to call
can't
you.
say
And
anything.
yeah, if you're not the qualified doctor, you can't say anything, which is so hard for the patients too, because we're already stressed out and we just want somebody to give us the answer immediately.
Exactly.
I broke my foot a couple years ago, and this was, oh gosh, maybe it's 5 or 6 years ago now, more than that. And when I went for the x-ray, the girl was just like, I can't tell you anything, because I was like, is it broken? Is it broken? And the x-ray tech was like, no, I don't know, but I can show you the picture. And it was very obviously broken. So she was like, you can look at the picture, but I can't tell you anything. And I was like, what? So frustrating.
Just in case it contradicts what the doctor says, we can't say anything.
Yeah, I understand the logic behind it. And I know with the Sue happy society we live in, I get that. But everybody has to watch their backs. But I think those people look at that stuff all day, every day. So they have to know mostly what they're looking at. I feel like the times that they would maybe, excuse my French, fuck it up is pretty rare. But I started
Definitely.
understanding ultrasounds of my uterus and my
Oh my God,
ovaries.
yeah.
Like I saw so many of them because they would show them to me while I was in the room, and they would, in the very beginning, they would point out this, look, this is this. And then I could just look at it and then be like, oh, yep, know what I'm looking at. Thanks for that. So you look at them enough,
Yeah.
those people know what they're looking at. They just, I hate that rule that they can't tell us.
Hmm.
Your mom
Well, the fun
was she ultrasound or
X-ray tech,
x-ray? X-ray.
X-rays, yeah.
Yeah. It's been a long time since she's done that though, huh?
Yeah.
Do you think she
Because she
missed
didn't really
it?
want to. No.
Oh, okay.
It was more she just wanted to get married and have kids.
Yeah. Yeah, sure. Nothing wrong with
And
that.
that's a totally valid, totally valid.
Yeah, absolutely. I don't know. I feel like
But
if
it
I was going to go
is,
into the medical world, I could do
yeah.
x-rays or ultrasounds. That seems safe.
Yeah, definitely.
I don't think I could do like needles or surgeries or I don't know.
It's a little bit funny to me, my first encounter with an eye injection.
Mm.
I was doing a volunteer clinic at my first job. That was when I was just doing eye prescriptions and glasses and whatnot. And they were like, hey, do you want to watch one? Of course, morbid curiosity. Of course, I want to watch. And I get into the room. It's an emergency clinic. They're just going through and doing these injections. And the doctor was like, hey, kid, hold my syringe for me. So I'm like, I'm holding the syringe. I'm like, oh my God, what am I doing here?
You don't do the actual injections though, do you?
Oh God, no.
You just
That's
like
the
the
doctor.
fist. Yeah. Yeah. Yeah.
I just get
Needles are,
them medication ready to go.
oh yeah. There you go. Get them comfy, get them numbed probably.
Yep.
Nice. All right. Thank you again for sharing your story. Do you have any parting words before we close out here?
If you think something's wrong, get it checked out because the possibility of something being wrong is very possible.
I think paying attention to your body too. Being in
Definitely.
tune with your own body helps you be able to pick up on those things.
Definitely. 100%.
Yeah. Well, cool. All right, my dear. Thanks for coming on.
Yeah. Thank you
And
for having me.
thank you everyone for listening. And we'll see you on the next episode.
See ya.